flu season has yet to peak, but in some regions of this country, including in Alberta, there have been a spike in the virus. Measles is also spreading rapidly in the United States. Vaccination rates remain low in the meantime, while health misinformation continues to grow. Joining us this morning is Tim Caulfield, who is the director of Health Law Institute at the University of Alberta. So, Tim, you and I have talked vaccines a lot, and vaccine fatigue seems to be quite real. But is there any science to dispute that they help protect people?
Look, this is the best example of the harm that misinformation can do. We know that health misinformation is playing a big role in hesitancy and people not getting the vaccines. Let me just give you some numbers here, Kent. A recent study by the Canadian Medical Association found that 26% of Canadians are hesitant about the measles vaccine because they believe that the connection between measles and autism, which is a complete lie. In fact, a 2023 study found that if you ask parents who are hesitant about the MMR vaccines, the measles vaccine, they say it's because they're worried about autism. Again, no evidence to back that up at all. In fact, let me give you one number. 100%. I got props today, Ken. 100%. This was a study that was done at UBC by David Sweet and the Clarity Foundation, and they did a survey of pediatricians in hundreds of pediatricians in BC, and 100% said that childhood vaccines are safe and effective. But unfortunately, we're seeing an increasing rise in hesitancy.
Now, zombie science plays a role in this and other things, which is scientific studies that are published and then debunked by other science, but that original study or research just lives on and continues to get a following. Why does this happen, or how does this happen where something is published and then debunked but still can live on for years and years?
Yeah, I love the term zombie science because you just can't kill these bunk studies. And of course, the very, very best example of it, again, returning to that autism and vaccine lie, is David Wakefield's 1998 study that allegedly found a connection. It was debunked. It was found to be fraudulent. He lost his medical license, et cetera, et cetera, et cetera. But the influence of that study lives on. It is definitely a zombie study. And there are a lot of other examples, Kent. And what happens is these studies become part of a conspiracy theory. They become part of a movement. So the retraction and the authors losing their license, it becomes part of the conspiracy theory. Of course, they've lost their license because they're brave enough to tell the truth. And this is really, really problematic. In fact, studies have shown that zombie papers continue to get referenced in the academic literature, continue to have an impact on public perceptions, as we've seen with vaccines.
So for everybody who's watching at home, science has this way of doing this. Like they're going to publish something and it's going to be tested. How does someone just at home trying to keep up with this know that they're getting the best information?
Yeah, this is the real challenge because our information environment has gotten so noisy. There are all these really bad studies that are out there kind of polluting the literature. It is getting more difficult to tease out, the good stuff from the bad. So always turn to what does the body of evidence say on this topic. Never fall for the single study syndrome, right? That this idea that one study that is an outlier is the one that you should listen to. And of course, you want to go to trusted voices, including your family physician, and you want to go to websites like the Public Health Agency of Canada that have evidence-informed advice on vaccines.
Tim, we always appreciate your advice. Thank you for navigating through and tracking down that zombie science. We always appreciate it.
Thanks so much, guys.